Hello, I'm Abdulrahman Kabi, and now I'll talk about extraoral and soft tissue examination of this patient. So first, we're going to start with the frontal examination at wrist. The facial form is ovoid, and when we talk about the facial symmetry, we can see the face is symmetrical. When we draw fifths on the face, we can notice the lateral fifths are slightly narrower than the central fifths, and the mouth is narrower than the interpupillary distance. Now frontal examination at smile. The incisor display is more than 75%, and the smile arc is consonant. The maxillary midline is centered while the mandibular midline is not visible. There is asymmetrical gingival display of the right and left side of the canines. When we talk about the profile analysis, the soft tissue profile or the facial convexity is within normal, about 10 degrees, and the mean value is 12 degrees, plus or minus 4 degrees. Now when we talk about the vertical facial proportions, we can notice there is decreased lower facial third, which is 3 centimeters on the screen, while the upper third is 3.5. The length of the upper lip is 1/3 the total length of the lower facial third. The nasolabial angle is obtuse, about 120 degrees, while the average value is 90 to 110 degrees. Now when we talk about the maxillomandibular prognathism, the distance of the subnasal in vertical line is 6 mm, which is within normal, and the mean value is 6 plus or minus 3. The pogonion should lie on this line or close to it at 0 mm plus or minus 4 mm. Now to the assessment of the nose. The nasofacial angle is within normal range, which is 35 degrees, and the normal range is 30 to 35 degrees. The nasomental angle is within normal range as well, which is 130 degrees. It ranges between 120 and 132 degrees. The mentocervical angle is within normal range, which is 117, and the normal range is 110 to 120 degrees. The submental neck angle is within normal range, which is 122 degrees. The normal ranges for men is 126 and for women 121. Now let's talk about the lip position, the A-line or aesthetic line of rickets. There is normal upper and lower lip. The position of the upper lip is 3 mm behind this line, and the lower lip lies 3 mm behind it as well, and the upper lip is 1 mm behind the lower lip. Burston line. The lip position is within normal. The most prominent point of the upper lip is 3 mm, plus or minus 1 mm, anterior to this line. The most prominent point of the lower lip is 2 mm, plus or minus 1 mm anterior to this line. The S-line or Steiner line. The upper and lower lips are too flat. As we can see, when the lips are lying behind this line, they are too flat. If they are anterior to it, they are too prominent. The Merrifield Z angle. It is within normal range, which is 82 degrees here. The normal range is 80 plus or minus 9 degrees. The interlabial gap is within normal range, which is 3 mm in here. The mean value is 2 mm plus or minus 2 mm. Now to the problem list. When we talk about the anterior posterior plane and the soft tissue, there is obtuse nasolabial angle, which is 120 degrees. When we talk about the vertical plane, the skeletal problems, there is decreased lower third, which was 3 centimeters, in the lower third and 3.5 in the upper third. When we talk about the dental problems, there is asymmetrical gingival display of the right and left sides of the canine. And finally, when we talk about the transverse plane, there is unequal transverse fifths and slightly narrow mouth relative to the interpupillary distance. Here are some pictures intraorally to that patient, and thank you.